Hi there. Welcome to PubMed for Librarians, Customization with my NCBI. My name is Rebecca Brown, and I'm a Training Development Specialist with the National Network of Libraries of Medicine Training Office. Today, we're going to work through many of the features that a My NCBI account offers that can help streamline your time in PubMed. These are things that you might also want to consider showing your patrons to help make their searching more efficient. We're going to do some hands-on work today. There's a handout associated with this video. There are 7 exercises on the handout, and I'll work through as many as time permits, and then you can pick up where I left off. You will need a MyNCBI account to do the exercises. If you don't have one, this would be a good time to stop the video and get one. I'll show you where to do that real fast. I'm going to minimize the slide. Here I am at pubmed.gov. In the upper right corner, it says sign in to NCBI. Go ahead and click on that, and that's where you will set up an account. Okay, so let's look at the agenda. We're going to talk about all the different ways to sign in to my NCBI. Then we're going to look at my NCBI filters that you can add to the right side of your page. These are in addition to the built-in left side filters. I'll also show you how to create custom filters. Then I'm going to demonstrate a rarely discussed feature called shared settings that creates a customized MyNCBI experience for users even when they're not logged in to MyNCBI. Sort of like magic, and I'll show you how to do that. And then once we're in MyNCBI, I'll show you some options you can apply to customize the PubMed interface. And then lastly, we will save a search, create an alert, and share a collection. So I'm going to head into pubmed.gov, and then this would be a good time for you to log into your account if you have one. And today we're going to take a see one, do one approach. So I'll demonstrate the exercises you can watch, and then you can use the handout to pause the video and give it a try yourself, and then start the video up again. Okay, to start with, I'm going to click on the Sign into NCBI link in the upper right corner, and it takes us to the login page. Now, logging into an account is generally not rocket science, but we have heard from librarians across the country that they get pushback from users, healthcare providers, nurses, nursing students who don't want to have to remember another username and password. So PubMed has made it a little easier, giving you some options. Many of us have a Google account. We use Gmail, so you can use that. If you or the people you serve have received an NIH grant or applied for an NIH grant, then they would have received a username and password from NIH, and they can use that. And then they can also, if they received a grant and are ready to submit their paper to NIH, once again, they will have received a username and password, and they can use that. In addition, there's a link here that says See More Third-Party Options, Sign-In Options. I'm going to click on that. So these are institutions that have worked directly with the National Library of Medicine to streamline the login process. You'll see a number of institutions on here, and I'm going to scroll down real fast to the University of Utah because they are my employer. So, for example, how does this work? So most of us, when we get to work each day, we log into our computers, our institution's network with a username and password. And that's what I would use here as well. If your institution is not on this list, there is a link right below it that says can't find your organization on this list. You can hover over that, and it provides instructions on how to start the process to get on the list. You will have to involve your network administrator, somebody in the computer or IT department, because it takes what they call like a digital handshake between NIH and your institution. But for today, I am just going to use the sign in with a NCBI account that I've had my username and password. Okay, and you can tell you're logged in, looking up in the right corner again, because, well, it gives you the option now to sign out. Okay, so let's take a tour of some of the features of My NCBI by clicking on the link that says My NCBI. All right, now I refer to this as the landing page. And if you scroll through here, your setup might be a little different because you can move these windows or portlets around. So when you, each portlet has a header with a title, and when you put your mouse over it, it turns into a little crosshair. You can then click and drag and drop, move it back, customize it to your liking. You can also use this little arrow to minimize each of the little portlets or expand them. And then if there's something that you don't use ever, you can use the little X. And let me show you what happens when you do that. You get a message. Are you sure you want to do this? It's like, yes, yes. And it tells you how you can bring this portlet back at a later date if you want to by using the customize this page link on the top of this page. And we can't really see it, but it's right back here. I'm going to click OK. There's that customize this link because this message, please go to, oh my God, the message is gone. Right. So it does not stay there long at all, but luckily we know that we can go to customize this page, which is what I'll do right now. And this is a list of all of the windows that you can have open. And I'm going to add that NCBI search box back to my list. And it goes back to where it came from. Okay, so let's scroll down here and take a look. Remember, my order may be different than yours. So we've got the NCBI search box here, which lets you defaults to PubMed because I'm in PubMed, but I can search any of the other NCBI databases. There's Mesh, for example. To be honest, I only use this box when I teach this class. Then there's filters. Once again, I'm in PubMed, so it defaults to that, but we'll take a look. You can make filters for the other databases as well. Recent activity, we're going to talk about this a little later. I'll go back to the top. Here are my saved searches, my collections. Notice at the bottom of all of these portlets is an area, a link that says Manage Saved Searches. So you have the option to make changes. And the last window I want to show you is CyNCV. CyNCV helps users create an online profile that they can share with others, really geared toward the research or publishing community. People who have received an NIH grant, for example. However, any PubMed user can create a profile. I am not published, but I have created a profile. Users can create one from scratch, or if they have received a grant from NIH, their profile will automatically be loaded into CyNCV from their grant application, and then they can edit, hide, or actually delete it. There is a link to read more about CyNCV on the last page of the handout. So that is all I'm going to say about CyNCV at this point. Okay, so we've already demonstrated how to move these things around and customize this page to your liking. Let's explore the filter options that we have in My NCBI. Okay, so I'm going to click on, here I am, here's my window. I've got some filters set up already. Like I said, it defaults to PubMed. I'm going to click on Manage My Filters. So why would I want to set up filters on the right side when I already have filters built in to PubMed. So for example, here we go. I'm going to switch tabs. Here are my right side filters. And here are the default filters on the left. Using My NCBI filters allows you to choose and display the filters that you use most often without having to make them visible on this left side filter bar. So for example, I know a librarian that works at a children's hospital and uses the adolescent age filter a lot. And by having that set up on the right side, as I did here, she saves herself 7 clicks each day when she wants to bring on or use that adolescent age filter, because it is not a default filter on the left side here. So for example, she would have to click on the bottom, show additional filters, choose ages, show, and adolescence is not in this list, hit customize, etc., etc. And on top of having to click and click and click to bring on the adolescent age filter, anything that you add to the left side filter bar will disappear after 8 hours of inactivity, which generally means for most of us that we leave for work at the end of the day, we come back more than 8 hours later. When we get back to work, that filter that we added after clicking 7 times will be gone, and we'll have to click again to bring it back on to the left side. But as long as you're logged into your My NCBI account, these filters on the right will stay in force. Okay, let me go back to the filter portlet here. All right, so let's explore. Now, we've got this big Create Custom Filter button in the middle. It wants us to push it, but we're not going to do that right now. We're going to come back to that in just a moment. We're going to start on the right side where we are asked to select a category. There are 4 categories, and it defaults to popular with a list of the popular filters. So I use English. Free full text is very handy, especially for people who are not associated with an academic institution or any institution that has subscriptions. Published in the last 5 years, I know, is one that a lot of people like to use. Now, we cannot search in this area, in the popular area. This is grayed out in a sense. Then the next section is link out. I'm going to switch to that. And so here we have a number of options available. I'm mostly going to let you explore this area, but I do want to say a couple of things. When many of us hear the term link out, we immediately think about library holdings linked to PubMed, or PubMed linked to our library holdings. That is definitely a thing, but link out, not LinkedIn, link out also means other things too. So let me show you what I mean. I have a PubMed ID that I'm just going to look up real fast here. 28286776, and it doesn't really matter what the citation is. I just need something. And what I'm going to do is I'm going to scroll to the bottom of this citation, past the mesh terms and the publication types, and we see an area that says link out more resources, and I'm going to click on that to expand it. So this area has places where you can find the full text. Let's just say if you're not associated with an institution that has subscriptions. But then in addition, there are links to other resources about the topics that are covered in this article. So apparently this article covers depression, insomnia, and acupuncture. And so we have links that will take you out to other resources about that topic. So back here in the My NCBI filter portlet, I'll let you explore that. All right, so now I'm going to click on Properties, and this is my favorite section. It's like shopping, but everything is free. So let's browse here. So first we have, whoops, age groups. And this is where you would find that adolescent filter, if that's something that's helpful to you. These filters are mesh terms. So when you apply these filters, you are actually limiting to Medline citations. That's not a bad thing, but these are one-to-one correspondence to mesh terms. I'm going to close that up. Then we have clinical queries. If you apply or add any of these filters, these are the very same filters, and if you attended or have watched the evidence-based medicine video we've created, we showed you PubMed clinical queries. And so those filters relate to this tool right here, the clinical studies categories, the 5 different categories, and the 2 different scopes, broad and narrow. So you can add those to your right side filters if those are helpful to you. That's something maybe you'd want to show a healthcare provider, some sort of practitioner which is what that clinical queries tool is designed for, or who that is designed for. Then there's entree date. This is the date citations were entered into PubMed. Last 10 years, 2 years, 3 months, what have you. I know a lot of people like that entered in the last 5 years. So you can have that there as a filter for yourself all the time. This next choice, Health Services Research Queries, I'm going to jump over here. This was another tool that we show in our evidence-based medicine recording. So you'd find it topic-specific queries, takes you to what I refer to as the blue page, Health Services Research. And so these options, the categories and scope, can be brought on using your My NCBI account as well. Humans or animals, you can have languages, publication date, publication type. These were discussed during MESH and the EBM session. These are MESH terms, and once again, we'll bring in your Medline citations. Okay, let's make that smaller. Let's see what else there is. Subsets, yes. This also takes you to what I refer to as that blue page. Let's go back here. If you attended or watched the building and refining a search session, we showed you these different search subsets here, and you can bring those on to your right side filters. It's the very same options here. Dental journals, I believe Medline. So this filter would limit your citations to Medline citations. Nursing journals, I know a lot of us use this filter. Students come in, I need 5 citations from nursing journals. Boom, there they are. Okay, and then last but not least is links. Now, mostly, well, let me demonstrate what this does here. So I have chosen links to Gene, and I am going to run a search here. Let me go back to PubMed, and I'm going to search for Parkinson's disease. All right. And now I'm going to find my links to Gene right here. Okay. So what this does is when I choose a citation, I'm going to scroll, scroll, scroll. I'm going to use the related information section on the right side. This whole right side is called the discovery bar. And so what that links to gene filter did is now I am looking at all citations about Parkinson's disease that have links to the gene database. So this particular article, if we look here, discusses 2 or 3 different genes. So if I click on the word gene here, it's going to take me directly to the gene database. So these filters, these links to genes and these other filters here are really for very specific users. If you work with geneticists or people who do gene research, then they probably already know about the gene database here, but they may not know that they can quickly jump from a PubMed citation to the gene database to connect with all this information here. Okay? So once again, you can look through there and see if anything really applies to the work that you do. Now I'm going to jump back to properties just for a moment and show you that if you don't know where to find a filter, it's very likely that it's located in the properties category. So you can search, for example, if you want the Medline filter, there it is. Or if you want nursing journal filter, there it is. So that is helpful as well. Okay, so now if you'd like to pause the video and do exercise 1 and add some filters for yourself, this would be a great time to do that, and I'll catch you on the other side. All right, so now I am going to run a search. I'm back on PubMed's homepage. I'm going to run a search for Parkinson's disease again. Oh, this time they put an apostrophe. It's okay. Okay. And I'm going to apply one of my right side filters, 80 and over. So I'm going to go from 97,000. It shows me to 8,828 results. Okay. And now that we've applied that right side filter, it's highlighted in a light shade of yellowish orange. And then to the right of it, there is a little, what we call an elusive plus sign, because it's very hard to see. And when you hover over it, it says add this filter to your search term. So what does that mean? I searched for Parkinson's disease, but if you look at search details, I'm going to scroll down to the right. I'm going to click on see more. We don't see any mention of that 80 and over filter. And if I want it to be captured, if I want that filtered search to be captured in my history, maybe I want to save that search, then I would have to use this little plus sign. So I'm going to add it. I'm going to click the plus sign. Now you see that it's been added to my search box, but it still is not an official part of my search. In order to get it to become an official part, I actually have to rerun this search. So I'm going to do that. I get that 8828 that I already knew I was going to get. But if I scroll to search details and click on see more, we see that it's has now officially been added to my search. And if I click on advanced, that's just below the search box, I can look at my daily history and see that, yep, it is there, whereas it wasn't before. And I could click on the search number, and our numbers are going to be different from each other. And I can save it from here if I want it. So that can be helpful. All right, I'm going to go back just a moment. A couple of steps, I guess, here. All right, so I applied that 80 and over filter and made it an official part of my search. And after taking those steps, maybe I want to apply another filter. So what happens? Well, with the right side filters, you can only apply one at a time. Whereas if I'm using my left side filters, I can apply more than one and my results will be filtered accordingly. The only way to add more than one right side filter at a time is to start by officially adding it to your search by using that elusive plus sign, and then rerun the search so it registers in your history, and then come back and add a second one. So this time, I'm going to add the links to Gene filter. I'm going to click on it. So now I'm filtered down to 1117. There's my elusive plus sign. I'm going to click it. It's been added to my search box. It has not yet been registered in my history. I have to rerun it, rerun the search. And let's look in advanced and see how that's been added. And then, yes, it's been added to my search, and I can save that from here if I wanted to. Okay, now a question we've been asked is, why would I want to jump through these hoops to apply multiple right side filters when we've got these left side filters built in here? And for me, the point is that I don't have to go through those 7 clicks on a daily basis to bring up the adolescent age filter, for example, or links to Gene. I don't believe is even a filter here on the left side. It's not an option. And in addition, we can make custom filters, which we're about to do. So, all right. Okay, to get to the filter portlet, let's click on My NCBI in the upper right corner again. Remember, you can sit back and relax, and then you can stop the video. So here's my filter portlet. I'm going to click on Manage Filters at the bottom. Now we finally get to click on that big blue button, Create Custom Filter. Now, I may not have said this earlier, but you're allowed up to 15 active filters per NCBI database. So I have a few others set up, but I'm at 11 right now. And I'm going to click Custom Filter. And here in this box, you can add anything. You can add what some people might call keywords, so maybe the word cancer or flu or malaria. You can put in search strings that include Boolean operators. You can put in tagged terms such as neoplasms tagged as a mesh term. It doesn't have to be just one word, but that is what I'm going to do right now as well here. So I'm going to type in has retraction in. This is a command that you can use. This is also listed on the handout. And I'm going to test my query. So about 5,800 results were found. And when you click in the Save Filter box, it will name the filter. So I'm going to click on Save. Okay, so it's been saved. But here's the rub. We think it's been saved. We go on our merry way. However, we now need to activate it. So we check the box, and then we're going to get a message that says it's been activated. Just the word cancer. Very broad search, just to demonstrate. And I am going to scroll to the bottom of my list, and I see out of my 3,000,6,400, etc. results, 1,306 have a retraction in it with regards to cancer or something. So that's a custom filter. So now you can pause this video and stop for exercise 2. It's on pages 4 and 5 of the handout. And then come back when you're done. Okay, so the next thing I want to demonstrate is how to set up shared settings and what that actually means. So I'm going to go back into my NCBI using the link in the upper right corner. And now we want to click on NCBI Site Preferences, the link. And there are actually some other things here I want to show you as well while we're here. So in this Common Preferences section, I'll come back to links display, but we have highlighting, which I use a lot. Let's do that. So let me demonstrate that. Search for cancer. I chose yellow. One really cool thing about this is I searched for cancer and cancer is highlighted. However, cancer is an entry term for the mesh term neoplasms, which is also highlighted, even though I didn't use that term. So that's pretty cool. Okay. Auto suggest. When we start typing here, these are the suggestions. It's really, in a sense, autocomplete. These are search terms that users, PubMed users from around the world, have also searched for. So you can often find them on the list. Some people don't like it. You can turn it off on a search by search basis, or you can come into My NCBI Preferences and turn that on or off, however you'd like. Links display. I'm going to show you this, and it's not really going to explain anything, but I'm going to demonstrate as well. If you indeed choose links display for PubMed, you will want to choose the second one, plain links. Pop-up menu is not actually an option for PubMed or Mesh. So I'm going to cancel this, get out of here, and demonstrate what links display means. I have another browser here. So here I am in Mesh, and I am not logged in to my NCBI. I searched for cancer, and it brought me to neoplasms. Okay, this is what we would expect. We have a definition, the year introduced. Okay, I'm going to go back to my other browser, where I'm going to now search for cancer in Mesh. I am logged in to my NCBI on here. And notice that I've got the same results page in Mesh. However, this time there are links below each entry in Mesh. And the links are term specific, so they're not always going to be the same. And what this does for you is, if you just want to search for neoplasms as a Mesh major topic, or using the clinical queries tool, for example, which I'll click on here, I can click on that link. It's already run the search, and here are my results. I didn't have to find the clinical queries tool or tell PubMed I wanted to search for cancer or neoplasms as a major topic. I had those links in my display. So that's what that is. Now the last one I want to show you is shared settings. Now I don't have anything set up for this, my personal account here, but this is where you would come. There are document delivery settings, filter settings, and it means right side filters, highlighting, so turning on that yellow, blue, green, highlighting, whatever, and outside tool settings. Some of you use link resolvers, maybe EBSCO or serial solutions to link your holdings to citations in PubMed. So let me show you what the end product looks like. I'm going to cancel out of this. And I have something set up on another page. So many of us on our library websites, we have a link to PubMed. And that's what I've sort of done here. I just made a mock-up page, and I'm linking to PubMed. However, if you hover over this term, it says PubMed shared settings. I know it's very small and just disappeared. But if you also notice the very bottom of this screen, there's a URL that's displaying because I'm hovering over the word PubMed, the hyperlink PubMed. And it ends with, that URL ends with my NCBI share equals NTC. Now, the National Training Office that I work for used to be called the National Training Center, and I set this up a number of years ago when we were NTC. So this is how it works. Somebody comes to your library webpage, they click on PubMed. I'll do that right now. And you see I am not logged into my NCBI, but I can search for whatever, cancer, and I have right side filters set up and highlighting turned on. I get the very same results as I did in my own personal account. However, I'm not signed into my NCBI. It's magic. So the way to do this is you would want to set up a My NCBI account for your library. Maybe somebody who's create a new email account somewhere. It doesn't matter. You could use Gmail, create an account, a My NCBI account using the library's Gmail account, set up shared settings in My NCBI, and then users can come to your library's webpage, click on PubMed, and they'd have some options, some of these customization tools already set up for them. Now, if they are good PubMed users and have also set up their own My NCBI account, at some point they might want to log into their own account because maybe they want to save a search. Once they log into their own account, their own personal settings will take over. So these filters would disappear. And if they didn't have highlighting turned on, that wouldn't display either. So personal settings trump the shared settings. So that's pretty cool, I think. And here's an example of the library page at Duke University Medical Library. So on the left, they have a link to PubMed. I'm clicking on that. And I will run that same search for cancer. And notice I'm not logged into my NCBI. I get over 3 million results, and they have a set of filters, and they have not set up highlighting. That was their decision, but they do have a customized experience for people even when they're not logged into my NCBI. Exercise 3 on the handout covers some of these PubMed preferences, so you can take a look at those at your leisure. Let's move on and look at some of the other helpful NCBI features, such as saving a search, email alerts, collections, and recent activity is what I will wrap up with. Okay, so let me get out of this browser. And I'm going to go back to my NCBI and use my favorite little search box. And I am going to search for pre-diabetes in PubMed. All right. So if you want to save a search, you have to click on the link that says Create Alert. So it used to say, a number of years ago, Save Search. But they found, NLM discovered through user focus groups, what have you, that people were actually more interested in creating an alert. So you click on Create Alert, and the way you create an alert is to actually save the search first. So here you can give it any name. It does not have to match the search term. So if I was saving this search for my one of my classes, I could give it the name of the class, or the paper I'm working on. I could do that. I enter my search term here. I can test my search term. Yep, I get about 7,600 results. Would you like email updates? Yes or no? In this case, I'm going to say yes. And when I used to do library orientations, I used to tell students that you can do research in your sleep if you set up alerts. Because when you set up an alert, new citations that are added that match your topic or your search terms will be sent to you on the schedule you choose, monthly, weekly, daily. You even can choose which day of the week, the format. Do you just want the summary? Do you want the abstract included? Do you want the ugly Medline version? And how many results do you want to receive at a time? And you can send yourself a message to remind yourself, why did I set up this search? So I'm going to go ahead and hit save, although I may already have this one. I'm going to rename it. And I'm going to click save. Oh, it's giving me weird messages, but I'm going to go to my NCBI in the upper right. I'm going to find my Save Search portal right here. I'm going to go to Manage Save Searches. And it indeed did not save my search. Click on my NCBI. Here's my Save Search window. I'm going to click on Manage Save Searches. And there's my search at the top of the list. Now, whenever you see the gear, means you have some options. So I'm going to click on that gear next to my Save Search. And here, if you want to come back and maybe add terms to your search, you can. And that's part of the doing research in your sleep. As students or researchers receive updated citations, they can look at the terms that are used by other researchers and maybe refine their topic or their search, update it, what have you. So I'm just going to delete this for right now. I don't need to keep that. Okay. So the next feature I want to show you is collections. And I'm going to click on the breadcrumb and go back to my NCBI. Here we go. I've got my collection portlet. Well, I'll go ahead and actually run a search up here for cancer again. I like the searches that I can spell easily. So I'm going to choose just one or two of these results and locate the Send To menu on the right. Click Collection, Add to Collection. And here I'm asked, would I like to create a new one or append to an existing collection? Let's see if I've got one of these. I don't have one, so I'm going to create a new collection. Enter a name for your collection. The default name is incredibly unhelpful, so I'm just going to name it Cancer and save. Okay, and it says that that was saved. If you don't choose any, so there's a whole, well, my original search had, about 3 million results. If you don't choose any, I chose 2, but if you don't choose any, it will add the first 1,000, and then you can go back and add more if you like. One of the real cool features that I like about collections, and let's go into my NCBI, find that little portlet, manage collections, there's my cancer, is that I can make my collection public. By default, they're all private. So let's see what public really means. So let me click on the word private. So, and here is the option. And when I click, so why would you want to do this? So let's say you've done a search for somebody and you want to send them a list of citations. Some folks use reference management software. Others don't have access to things like EndNote, what have you. So you can make the collection public, and I'm going to save it. And I know sometimes people get nervous when we say make it public. And here, the public URL for your collection is this. Don't be confused and use the URL that's at the very top in your browser. That's a different URL and will not take people back to this collection. This URL will stay on this page in this collection until you delete the collection, and this is what you can share. Public means that others can view the collection, but they cannot add, edit, or delete the collection. It belongs to you. You're the only one. I'm going to go ahead and just click on that link. And this is exactly what people will see. Whatever the citations are that are in that collection will display to them. And that's all they will see. All right, so the very last thing I want to show you is recent activity. Now, on the right side of this page, of a results page, you'll see on the discovery bar an area that says recent activity, and it has the last 5 things that you did in this particular database. You can turn it off, clear it, or click on See More, which is at the bottom. I do not recommend clearing. Recent activity is sort of like a safety net because it retains your searches and records that you look at for the last 6 months. So I've come in here several times and I remember maybe one word from a citation I looked at or from a search I ran, and I can use the search box that's here and search for that particular item. You can search within titles only, and this is the only place that you can search within your results or within titles, for example. Now, you can, now we have heard from librarians who say, I don't want people to see how bad I am at searching. So, for example, let me jump back here for a moment. I'm searching for cancer. Okay. I ran a search, and I'm going to go to advanced. And there's that search. Now, you can, if I click on the number of the search, you can delete this from your history. We don't recommend deleting searches just because you often want to come back to them. But heads up, when you delete something from your daily search, it's actually retained in your recent activity in your MyNCBI account, assuming you were logged into MyNCBI. So if you are really trying to cover your tracks, you're going to want to come into recent activity, find that particular item, choose it, and delete it. You can also do some other things, save a search from here, copy something to a collection, etc.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.